Hello, Gold viewers. I'm Fiona Lang-Sharp, IBCLC and Public Relations Manager and MC for the Gold Perinatal Online Conference 2015. Welcome to my interview with Jessica McNeil. Welcome, Jessica. It's great to have you.
Hello, it's great to be here.
Well, it is lovely to have you. And when I was looking through your presentation, I know that this is a very deep subject and maybe something that we don't really touch enough on because we just make assumptions or we just get into our jobs and we care for those around us, especially for the perinatal nurse. It comes with the territory that she's going to be caring for the families. So what I'm talking about for everyone listening in today, Jessica's going to be talking about dealing with neonatal loss, meeting the needs of your patient without ignoring your own. What a great subject, Jessica.
Thank you. I feel very passionately that it's a very important topic that we need to be talking about.
Absolutely. So off the top here, when did you first notice that perinatal nurses were becoming depleted while caring for families who had suffered a neonatal loss?
Well, really, what brought this to the forefront for me was personal experience. On the unit that I worked on at one time, we went from, being a really happy unit, a team where it was exciting to come to work, where we had a string, just really circumstantial, of a lot of just high risk emergent cases that really had some sad outcomes. And I saw the impact that had on us as a team and that it had on our unit as a whole, and really saw everyone become emotionally depleted, which really led to a lot of people ultimately leaving, and the emotional toll that took when you lose coworkers on top of dealing with the emotional side of seeing neonatal loss with your patients.
Wow, so this really all came out from a personal experience, like you said. So as you were watching your colleagues, did you somewhat see that they were playing off of each other? The environment was then depleted, and there really wasn't any strategies, I'm expecting, that for them to really recover from this sort of instance that you had.
Absolutely, and it's funny when you work in such close environments with people, how you do feed off of each other's energy. And at the time, we were so busy, we had probably our census tripled, and the amount of patients that we were seeing, and so it really felt like no rest for the weary. So we really weren't taking the time to debrief from these emergent situations. It was just like suck it up and come back in, and you felt like you got knocked over all over again. And so really you could just see the complete toll that it took on people. You left exhausted, and you saw that in your coworkers and people that were typically happy starting to snap at each other. So it was
Wow.
really
Yeah.
unfortunate but interesting at the same time.
Yeah, absolutely. I guess, from the point of view of researching it, that's where it did become probably interesting to you, to try and discover, how to resolve it. Now, in your abstract, which I was reading, and of course I've had a sneak peek, at your presentation as well, but you talk about, strategies. So how have you been able to discern, the strategies which have really been helpful?
Well, really, as a unit, when we saw this coming and all of these things happening, we saw that the toll that it was taking on everyone. As a result, we started having a lot of people leave, and a lot of fairly new nurses leave. And so we really came together and said, what can be done? And really what brought that about was the chaplain at the hospital just started coming by randomly and bringing by a cart of tea and sitting and saying, we can just sit in silence, or we can talk. And sometimes it was for 15, 20 minutes, and sometimes it was just for 2 to 5 minutes. But when I started to see how people really needed that relief, and that even just those few minutes of being able to just breathe or talk about what they were feeling, then we started to think, well, what else can we do to dig into this deeper? and see if we can really turn things around. And when we started to see that it was improving things and it was improving teamwork, then we said, okay, we have to make some serious changes and make this a part of our practice.
Well, I'm truly inspired. I'm sensing that there's a real sense of community, even in your sort of depletion. You had the ability, or certainly with a little bit of help, but it seems like you had a sense of community there as well. So with your struggles, making your way back to where you needed to be. So tell me, lastly, Jessica, just briefly, what has been the most inspiring to you while studying this topic?
Really and truly, what's been most inspiring to me is just seeing, even in the literature and the research of studies that have been done when they've asked nurses how they feel emotionally when dealing with neonatal loss, is just really how truly sacrificial nurses are, that they're willing to put aside their own feelings and do whatever it takes to really care for their patient, even if that means, holding it all in or seeing themselves suffer emotionally. They really want at the bottom of their heart to make sure that that patient, first and foremost, has everything that they need. And just being reminded of that, it just made me so proud to be a nurse. It's brought back a lot of stories and memories of moments that I've had with patients. And it just makes you proud to be a nurse.
Well, that's very inspiring to me. And, without our nurses, where would we be, right? I mean, they are the crux of, the foundation of our care system. So I really appreciate you sharing your stories. It's been lovely hearing just the travels. I feel like I've got this little mini package now to work with in terms of who you are and how this all came about. But I know that you have a lot more to share, Jessica, and I'm really looking forward to hearing more. And I hope that our listening audience who's listening in right now, I hope you've been inspired just by the stories from Jessica right now. So just a reminder to everyone out there, this has been an interview with Jessica McNeil, and she's going to be speaking at the Gold Perinatal Conference 2013, and her subject is Dealing with Neonatal Loss, Meeting the Needs of Your Patient Without Ignoring Your Own. Thank you, Jessica, for being with me here today.
Thank you so much, Fiona. I'm really looking forward to you speaking and sharing my story.